Poor sleep by itself may not be what ends a life, but what happens during the first 30 seconds after waking could carry a far greater danger. There is one morning behavior that many Americans over 60 repeat every day without giving it any thought. Recent research indicates that it may raise the likelihood of a fatal cardiac event by as much as 40%. It is not smoking. It is not eating bacon. It is something that happens before your feet even reach the floor. The most concerning detail is that many physicians have never discussed it with their patients. Before identifying that habit, it is important to understand what takes place inside the body during the transition from sleep to wakefulness. While sleeping, the body operates in a reduced energy state. Heart rate slows down, blood pressure decreases, activity within the nervous system becomes quieter. This period represents the only true recovery time the heart receives during a full 24-hour cycle. What many people do not realize is that the awakening process begins before consciousness returns. Even before the eyes open or an alarm sounds, the body starts releasing the stress hormones cortisol and adrenaline into the bloodstream. Those hormone levels begin climbing approximately 60 minutes before a person becomes fully awake. By the time the alarm is turned off, the surge is already underway. These hormones affect the cardiovascular system in 3 ways at nearly the same moment. Heart rate increases, blood pressure climbs, blood vessels narrow. All of this unfolds within seconds. At age 35, the cardiovascular system generally manages this response with little difficulty. Blood vessels remain flexible and adapt rapidly. After age 60, the situation changes significantly. Arteries become less elastic. The body's response slows. In many individuals who believe they are healthy, plaque has quietly accumulated within the vessel walls. They may have no idea it is there. When the hormonal surge strikes a blood vessel containing unstable plaque, the increased force can cause that plaque to rupture. Once a rupture occurs, clotting begins. A clot inside a coronary artery can produce a heart attack. A clot inside an artery supplying the brain can result in a stroke. This is not a theoretical possibility. It is the biological process involved. Research published in the American Heart Journal reported that heart attacks occur 40% more frequently between 6 and 10 in the morning than during any other part of the day. This pattern is not random. It is rooted in human physiology. What happens during the 25 seconds after the alarm sounds can either help the heart navigate that hormonal surge or place additional strain on an already vulnerable system. Consider a patient identified as Douglas. Douglas was 68 years old and a retired school principal. He was careful about his health. He never missed his blood pressure medication. He walked for 30 minutes on 5 days each week. He attended his yearly medical examinations consistently. His most recent cardiogram showed no concerns. His physician considered him to be in good condition for his age. Then, on a Tuesday morning, Douglas woke up and followed the same routine he had practiced for 15 years. He silenced the alarm. He sat upright quickly. He swung his legs off the side of the bed and stood immediately. He managed only 3 steps toward the bathroom. That was where his movement ended. His wife discovered him lying on the floor. Later, when his case was reviewed, every aspect of his cardiovascular profile suggested someone who had been managing his health responsibly. His medications were appropriate. His diet was reasonable. His fitness level exceeded the average for a man of his age. Yet nobody had ever explained the significance of those 25 seconds. The conversation that followed in the recovery room revealed a simple adjustment that his cardiologist had never discussed. That single overlooked change is the reason this information matters. The habit in question is remarkably common. People wake up and stand immediately. The alarm sounds, and within fewer than 3 seconds they are already on their feet. It appears harmless. It feels completely normal. Yet at that precise moment in the morning, it may be one of the riskiest actions for the heart. The explanation is straightforward. When lying flat in bed, blood remains distributed relatively evenly throughout the body. The instant a person stands, gravity pulls a substantial amount of that blood downward into the legs and abdomen. The heart must react immediately to keep enough blood flowing to the brain. In younger individuals, this response is rapid and accurate. Blood vessels tighten appropriately. Heart rate shifts as needed. Blood pressure remains stable within seconds. For adults beyond 60, the process becomes slower. The vessels no longer react with the same speed. Blood pressure may fall by 15, 20, or even 30 points only moments after standing. Medical professionals refer to this condition as orthostatic hypotension. Many people recognize it as the gray, lightheaded, cloudy sensation that appears right after getting out of bed. A large number of adults over 60 experience it regularly and assume it is a normal part of aging. It is not considered normal. It serves as a warning sign. This is where it connects directly to the morning hormone surge discussed earlier. When blood pressure suddenly drops after standing, the heart attempts to restore circulation by sharply increasing both its speed and workload. In a vulnerable heart already dealing with elevated cortisol, less flexible arteries, and thicker blood, that sudden compensatory response may trigger an arrhythmia. It may rupture plaque. In severe situations, it can lead to a medical emergency. Standing up in less than 3 seconds is the 25-second mistake. Correcting it costs nothing. There is another reason the early morning period carries unusual risk. This detail surprises nearly every patient who hears it. After 7 or 8 hours of sleep, the body is dehydrated. This happens every morning without exception. No water has been consumed throughout the night. Breathing continues steadily for hours, causing a constant loss of moisture. As a result, by the time the alarm sounds, the blood is measurably thicker and more viscous than it was at bedtime. Imagine the heart as a pump and the blood vessels as a network of pipes. When fluid moves easily through those pipes, the pump works efficiently. When that fluid becomes thicker, each heartbeat requires greater effort. The problem extends beyond workload alone. Thicker blood is also more likely to clot. Research has shown that clotting factors reach their highest activity during the early morning hours. This is one of the major reasons heart attacks and strokes occur so frequently between 6 and 10 in the morning. The hormone surge, increased blood thickness, and stiffened vessels all arrive at the same time. Together, they create a triple threat for hearts over 60. The solution is remarkably simple. Drink 1 glass of room temperature water before anything else. Do it before coffee. Do it before medication. Do it before looking at a phone. A single glass consumed before standing helps dilute the blood, lowers clotting risk, and provides the cardiovascular system with support before the demands of the day begin. This is the protective practice mentioned earlier. Research published in JAMA found that it reduced early morning cardiac events by as much as 62% in adults over 60. 1 glass of water while still lying down, or seated before standing. Nothing more. Yet very few people perform it consistently. The complete morning approach is straightforward. It is called the 90-second heart protocol. No equipment is required. There is no expense. Nothing needs to be purchased. It is simply a sequence lasting 90 seconds that helps protect the heart each morning. The first step begins the moment the alarm sounds. Do not move immediately. Remain exactly where you are. Take 3 slow, deep breaths before doing anything else. Breathe in through the nose. Exhale fully through the mouth. Perform each breath slowly and intentionally. This action activates the parasympathetic nervous system, the body's calming pathway, and starts reducing the impact of the cortisol surge before it reaches its peak. 3 breaths, 15 seconds. One of the strongest cardiovascular protection tools available, and it costs absolutely nothing. This is the 25-second intervention. Nothing dramatic, nothing complex. Research examining slow, controlled breathing immediately after waking has demonstrated measurable reductions in morning blood pressure spikes among adults over 60. The second step is to drink water before standing. Place a full glass of water beside the bed tonight. Before your feet touch the floor, drink the entire glass at room temperature. This step is essential. The reason is already clear. Thin the blood. Lower the likelihood of clot formation. Provide the heart with better fluid circulation before the day starts. The third step is to sit before standing. Turn onto your side. Then slowly push yourself into a seated position. Remain seated at the edge of the bed with your feet hanging freely. Do not hurry. Slowly rotate your ankles in circles 5 times clockwise and 5 times counterclockwise. This movement activates the calf muscles, helping move pooled blood upward toward the heart and allowing blood pressure to recover in a gradual manner. Stay seated for a full 30 seconds before rising. After that, stand up slowly, pushing through your legs. Once upright, remain still for 10 seconds before taking the first step. That completes the entire routine. 3 deep breaths, 1 glass of water, sit before standing, 90 seconds in total. Beginning tomorrow morning. For anyone currently using a diuretic, sometimes called a water pill for blood pressure control, there is one more detail worth knowing. These medications remove excess fluid through the kidneys. They are commonly prescribed and highly effective. However, as fluid leaves the body, magnesium is often lost as well. Magnesium plays a critical role in regulating the electrical activity responsible for each heartbeat. When magnesium levels gradually decline, something that occurs in a significant number of people taking long-term diuretics, the heart can become electrically unstable. Palpitations may appear. Heart rhythms may become irregular. Arrhythmias can develop. These problems often become most noticeable during the morning hours, exactly when the cardiovascular system is already experiencing its highest level of stress. If you take a diuretic, ask your physician during your next visit to check your magnesium level. The test takes approximately 2 minutes. The result may provide information that is genuinely important for your heart health. Now, return to Douglas. After his condition stabilized, a conversation took place with him and his wife about what happened that morning. His description matched expectations perfectly. Alarm. Immediate motion. Straight from bed to standing. Then directly toward the bathroom. The same routine every morning for 15 years. No one had ever challenged it. His previous cardiologist had reviewed medications. Diet had been discussed. Exercise habits had been evaluated. Yet nobody had asked about those 25 seconds. Before Douglas returned home, only one adjustment was made. A glass of water was placed beside the bed. The 3-breath rule was added. He also began sitting on the edge of the bed before standing. 6 months later, he returned for follow-up. His wife had been monitoring his morning blood pressure readings at home. The numbers had become far more stable. The dizziness he once accepted as normal had disappeared. His cardiologist noticed the improvement and asked what had changed. Douglas replied, "I stopped getting up too fast. Why didn't anyone tell me this sooner?" He asked that question while standing in the hallway. There was no satisfying answer. What can be said is simple. The information is available. The research is available. The habit costs nothing. The entire process requires only 90 seconds. The challenge is making sure it reaches people before the morning when it matters most. Now bring everything together. The morning hours represent the highest risk period of the day for the heart. After age 60, cortisol and adrenaline begin rising before full wakefulness occurs. At the same time, heart rate increases. Blood pressure rises. Blood vessels constrict. Blood is at its thickest. Arteries are at their least flexible. Then another factor enters the equation. The habit of standing immediately after waking, something approximately 90% of people do automatically, creates a sudden drop in pressure that forces an already stressed heart to respond aggressively. The solution consists of 3 simple actions. Take 3 deep breaths before moving. Drink 1 glass of water before standing. Sit on the edge of the bed for 30 seconds, and then rise slowly. That is the 90-second heart protocol beginning tomorrow morning. Tonight, place a glass of water on your nightstand. Start with that single step. The rest can follow from there. Everything shared here is general medical information drawn from published research and clinical experience. It is not intended to replace personal medical care. Before changing medications, exercise practices, or daily routines, speak with your own physician first. They understand your medical history. Bring this information into that discussion. That is where effective medical care begins. If this information was valuable, share it with someone who may benefit from hearing it. There may be a person in your life following the same routine Douglas followed every morning. A simple 90-second change could make a meaningful difference. Take care of your heart. It works every minute of every day without pause. Give it 90 good seconds tomorrow morning. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.